This is Health Reframed, where we take an in-depth look at medical and scientific ideas, breaking them down into high-quality, accurate, and understandable information. My name is Jack Snyder. I have a degree in biomedical sciences with a concentration in anatomy and physiology, as well as 4 years as an EMT. I bring insights from both research and real-world healthcare. Today, we are going to learn about heart attacks. Each year in the United States, approximately 800,000 people experience a heart attack, and of those 800,000, 200,000 have had one before. So this is about one person every 40 seconds. Furthermore, heart attacks are one of the most common forms of death in the United States, with heart disease accounting for 1/5 of deaths in America. We all know that heart attacks are a grim matter. However, what exactly happens with a heart attack? What happens in the body? Can they be prevented? And what actually happens if you are having one? Today, expect to find out the answers to these questions and more as we delve into the physiology and medicine behind heart attacks. A heart attack, or myocardial infarction, occurs when one of the blood vessels that supplies the heart with blood becomes blocked, causing rapid damage to the heart muscle if left unaddressed. That's the longer scientific definition, but let's break it down a little bit here. Let's take the technical name for it, myocardial infarction, and break that down first. Myocardial refers to the muscular layer of the heart. Your heart is a muscle, after all. And infarction refers to cell death. So myocardial infarction simply refers to the death of the muscle cells of the heart. And this is caused by a blockage in blood flow. Your heart, just like all of the other organs and tissues in your body, actually needs blood and oxygen and nutrients to survive. When your heart pumps blood to your body, it also pumps blood to itself via the coronary arteries. However, if these arteries are blocked for whatever reason, then your heart or parts of your heart stop receiving blood flow. But what exactly can cause these arteries to be blocked? There's two main ways that the coronary arteries can be blocked, and the first one is by a blood clot, and the second is by atherosclerosis. Big word. A blood clot can form in a variety of ways. For instance, if you have surgery, you can have blood clots forming because your body is trying to repair the damage that's been done by the surgery. You are being cut into, after all. Furthermore, you can also have clots from sitting for long periods of time, like on an airplane. This can lead to a condition known as deep vein thrombosis. And what deep vein thrombosis is when one of the veins in likely your legs develops a thrombus, which is a blood clot that's connected to the vein. At this point, it's dangerous but not life-threatening. It becomes life-threatening if a piece of this thrombus breaks off. At this point, it is called an embolus. This embolus is effectively a little piece of blood clot that is now circulating your body, and it can get stuck in your heart, lungs, or even brain, causing a heart attack, pulmonary embolism, or stroke, respectively. But today, we're simply talking about heart attacks. The other way that a heart attack can happen is due to atherosclerosis. In this case, a clot does not travel to the heart and block a vessel, but rather the vessel, the coronary arteries, slowly close over time due to the buildup of cholesterol and fats, called plaque, in the walls of these arteries. This process is considerably slower and happens over time, but the difference between 98% closed and 100% closed is quite literally a heart attack. When one of these clots gets stuck in the coronary arteries or the artery closes from plaque buildup, this is bad news indeed. Though there are multiple coronary arteries supplying, each one only supplies its specific area. In other words, there's not total crossing over. So if one coronary artery gets knocked out, then there will be an area of the heart that ceases to have blood supply. And if this happens, the other arteries cannot compensate, and as a consequence, the affected area of the heart quickly loses blood supply, as well as oxygen and nutrients, and the cells begin to die. The danger of both of these is that when these cells die, the heart stops pumping blood, which of course is very life-threatening. The real rub here, though, is that once dead, these cells cannot regenerate. This means that if you have had a heart attack and some of your heart cells die, there is really little to nothing that you can do to bring them back. Because of this, it is of the utmost importance to be treated immediately if you're having symptoms of a heart attack. So let's go over what the symptoms are. The most common heart attack symptom is chest pain. Specifically, the pain is going to be presenting most commonly on the left side of your chest, and that's where your heart is. This pain can also radiate or move down your left arm and up the left side of your neck and jaw. This is due to overlapping connections of neurons. For instance, the neurons that detect pain in your heart overlap and connect with the neurons that detect pain in your arm, neck, and jaw. Naturally, if you have these symptoms, seek medical help and call 911 immediately. Other symptoms include shortness of breath, nausea, sweating, or fatigue. Another one that is relatively common in the emergency medical world is when the patient complains of having a sense of impending doom. Really heavy stuff. Though these are the main symptoms, they can sometimes be a lot more subtle. Furthermore, up to 40% of heart attacks go unnoticed. This is why it's so important to know the symptoms and seek medical treatment promptly, because it can indeed be a life and death situation. It's also important to listen to your body, and if something feels off and you have pain, even if it's mild pain, but something just doesn't feel right, it's better to be safe than sorry with this one. If someone you know is complaining about these symptoms, or even if you see a stranger in public fall over and complain of these symptoms, you really need to call 911. I think knowing the symptoms of a heart attack and knowing what to do should be common knowledge. I also think CPR should be common knowledge, but I don't make those decisions. Heart attacks are common after all, and knowing the signs and symptoms should be something that is taught, and that's what I'm trying to do here today. So let's break down what exactly happens when you have a heart attack and what that would look like. So let's pretend that you or someone you know has a heart attack. Let's follow the process start to finish so we can get an idea of what the treatments are and what the recovery looks like. You begin to feel a pain in your chest. It grows until it feels like an elephant is literally sitting on top of you. You begin to feel short of breath, so you sit down. Something isn't right, so you call 911, and in 5 minutes, the paramedics show up. Thankfully, you're still conscious. If you weren't conscious and had no heartbeat, the paramedics would have to start CPR immediately. In this case, you would be in cardiac arrest, which is when the heart stops pumping. If this was happening to you, it would be vital that the provider start CPR, or cardiopulmonary resuscitation. By giving CPR, you physically pump the heart and give breaths to the patient by bagging them, thus delivering blood to the body and oxygenating the blood with the breaths. While giving CPR, it's also important to find the nearest AED, or automatic external defibrillator, so you can deliver a shock to the patient and hopefully cause the heart to start pumping again. You can think of an AED almost as a restart button for the heart. If your heart is pumping normally, it is in what we call sinus rhythm, which is just a fancy way of saying that it's running properly. However, a heart attack can cause the heart to develop abnormal rhythms. And there are two main ones that are shockable. In other words, these are two rhythms that, if you're having them, you can give a shock, and there's a chance that the shock will restore the normal rhythm. The first one is called VTAC. VTAC is short for ventricular tachycardia, and this is what happens when the ventricles, or lower chambers of your heart, are beating very rapidly and irregularly. The other kind that is shockable is ventricular fibrillation. This is when the ventricles are quivering with uncoordinated contractions. The AED can sometimes act to reset these rhythms and bring the heart back to normal. AED use is paramount in these situations as it can drastically improve outcomes. One study that I found said that when bystanders gave CPR to someone having a heart attack, the survival rate was only 9%, but when the AED was used and a shock was given, survival jumped to 38%. That's over 30% better success rate, which with heart attacks, every percent and every minute really does count. But that was a bit of a tangent. In this example, you are indeed awake the whole time. So what's the first thing that happens? Likely a couple of things will all happen simultaneously, and here's some of what's going to happen. The EMT gives you aspirin, which is normally given to limit the growth of a clot. Aspirin is a thromboxane A2 inhibitor. This Thromboxane A2 is a chemical messenger in your body that causes platelets in your blood to aggregate and form clots. Clots are made of platelets, so if you can stop them from aggregating and clumping together, then no more clot will form. This treatment can help to slow the further formation of the clot in the coronary arteries. You are also put on an oxygen mask, and this is to make sure that the cells of your body are fully oxygenated. While all of this is happening, the EMT is putting stickers all over your body. This is for an EKG, or an electrocardiogram. This test will effectively take a picture of your heart by reading the electrical signals given off by different areas of your heart. When your heart pumps, electricity is actually used to cause it to pump, and the EKG looks at the different areas of your heart physically and reads the electrical signals, which can give a picture of what is going on in the heart. The paramedic will be able to read this and get a better idea of if you're having a heart attack or not. Furthermore, they will also likely give you an IV, and they will give you medications or fluid through this. You say that you're in extreme pain, so they likely either give you morphine or fentanyl. You're on your way to the hospital now. They wheel you in, and they get you in a hospital bed. A bunch of people swarm around you, and they start drawing blood for what is called a troponin test. Troponin levels increase in the blood when your heart muscle is died, or in other words, the heart muscle cells release troponin when they die. So, this test can help diagnose a heart attack if troponin levels are elevated. Heart muscle cells die, they release troponin, so if your troponin is up, it means that heart muscle cells are dying. They may also perform other tests and procedures to confirm the diagnosis. The hospital staff wheel you to the so-called cath lab. This is where they will perform procedures to not only confirm the diagnosis, but also correct the heart attack. A coronary angiography is one such test that involves inserting a catheter or a thin straw-like tube through the groin or your arm into an artery. They then guide this tube all the way back to the heart, and from here dye is released, which helps visualize the coronary arteries over an X-ray. So they release the dye and take an X-ray, and then from the X-ray they are able to visualize whether or not the vessels are blocked. Finally, they may also do an echocardiogram, or echo for short. An echo is simply an ultrasound of your heart. This can show how the blood flows through the heart and identify which area has been damaged. They confirm the diagnosis, the symptoms do line up, the EKG showed a heart attack, as did the angiography. So what's next? What are they going to do? How are they going to treat the heart attack? Upon arrival at the hospital, they may have started treatment already. They may have given you a clot buster medication that helps break down any blood clots in the arteries. Giving these drugs early can be very important because the quicker you identify a heart attack and give the clot buster, the less damage is done. Nitroglycerin, or nitro, is another medication that may be given in the field or in the hospital. Nitro widens the blood vessels, which can improve blood flow to the heart. However, sometimes medication is not enough to fix a heart attack and surgery may be needed. First things first, we need to get that clot out of there. This, again, is done in the cath lab we talked about earlier. The doctor will insert a thin tube, another catheter, into an artery in the wrist or groin and guide it up to the heart. From here, the doctor will use a tool on the end of the catheter to remove and capture your clot. However, a more common procedure is called a pericutaneous coronary intervention, or PCI. In this procedure, we, once again, as we have with all of these, go in with a catheter into an artery, guide it back to the heart, and once the doctor has found the clot in the location, they inflate a very small balloon on the end of the catheter. And this is going to open the site up and allow blood flow to continue. From here, a stent, which is a small wire mesh tube, is placed in the artery to keep it open so that it doesn't close again and so that blood flow remains in that area of the heart. The anesthesiologist gives you sedation and you drift off while the surgeon inserts the catheter. As you wake up, the doctor is standing by your side. "The procedure went well," he said. "We removed the clot and placed a stent in your coronary artery. You feel relieved. This has been a hell of a day." In extreme cases, open heart surgery may also be performed. Often, a coronary bypass surgery is done. In this surgery, the surgeon removes a healthy blood vessel from somewhere else in the body, like an artery from the chest or the wrist, as well as a vein from the leg. This new vessel is then added to the heart so that the blood can flow through this new vessel and not through the blocked artery. Hence the name, a coronary bypass, since you put a new vessel in there that bypasses the coronary artery. These procedures are often necessary to treat acute heart attacks, and they can sometimes be used as preventative measures. However, using invasive procedures like putting in stents or doing a bypass surgery really may not be the best move in prevention of heart attacks. A study from Stanford showed that invasive procedures do not improve long-term patient outcomes any more than medications and lifestyle changes. This is good news indeed, given that these procedures are very invasive and very expensive. So if you can get the same effects with lifestyle changes and medications, that's great. All that said, your heart attack is over and you made it through. You survived. This is great news because survival rates aren't always the best for heart attacks. But unfortunately, you aren't scot-free yet. Now that you've had a heart attack, there are going to need to be some changes. After the removal of a clot and placement of a stent, the battle is far from over with a heart attack. Like I said before, time is a huge factor, given that survival rates for heart attacks are only 60%. Being quick can increase the chances of survival. And you were lucky enough to survive, so how do you proceed from here? Well, you're going to need to start the recovery process. You're going to feel weak for around a week after your heart attack. There will also be changes in your emotions, diet, and activity levels. You're not going to want to feel like to do much. Your sexual drive will go down, and you won't feel as hungry. That said, you do want to keep moving, doing basic daily tasks like doing the chores, doing the dishes, brushing your teeth, making your bed, as well as pacing yourself is very important. You may also join a cardiac rehab program. In this kind of program, you exercise under the supervision of professionals, and they will give you a program tailored for recovering from a heart attack. Before you leave the hospital, you will have likely gotten prescriptions for some new medications as well. They probably put you on a blood thinner, like aspirin, warfarin, or heparin. These drugs are going to keep your blood thin in the sense that it will be more difficult for clots to form. Less clots means that you have less chance of a clot forming and causing another heart attack. Unfortunately, this does happen. 1 in 5 people who have had a heart attack will have another one within 5 years of their first heart attack. So following what the doctor says is pretty important so that it doesn't happen again. The doctor may also prescribe medication to lower cholesterol. If you remember from earlier, some heart attacks are caused by the buildup of cholesterol in the arteries. You may also be given a prescription of nitroglycerin to have on hand in case you have another heart attack. Nitro can be given if you feel chest pain and can open up your blood vessels in a pinch. Finally, you may be put on some medications to lower your blood pressure. If you're interested in learning more about blood pressure medications, listen to my episode on hypertension where I go in depth on these medications. And besides meds, you're probably going to want to implement some lifestyle changes. Exercise is often recommended after a heart attack, specifically aerobic, because it'll help strengthen your heart. This is going to include things like running, biking, or swimming. Like hypertension, I've done an episode on this as well, so if you want to learn more about the specifics of exercise, go check out my episode on that. Eating a heart-healthy diet is going to be very important as well to reduce the risk of having another heart attack. This is going to go hand in hand with exercise, especially if you want to lose weight. Eating fruits, vegetables, lean meat, whole grains, while limiting sugar, salt, and alcohol, and processed foods can help recovery and long-term outcomes. Funnily enough, all of these post-heart attack treatments also fall into the category of heart attack prevention. Obviously, best case scenario for everyone would be not to have a heart attack in the first place. So learning what to do to prevent heart attacks is something that I think is important to learn. Exercise and diet play a large role here as well, unsurprisingly. Giving your body fuel that is quality will indeed cause your body to run better. It's like putting higher octane gas in the car. Limiting cholesterol intake is also important because having less cholesterol means less cholesterol to build up in the arteries and less blockages to occur. Limiting tobacco use is also important for heart health in general, so quitting will make a big difference. Or cutting back as well. Other factors can be important for prevention as well. Reducing stress can improve heart health, so practicing mindfulness, getting outside, spending some time with friends and family, really whatever works best for you to get more relaxed more often. Sleep, We talk about sleep a lot. Sleep is important for everything. Quality sleep improves probably every available metric in your body, so make sure you get some good sleep. It's not going to just help your heart, but literally everything else in your body, so get some good sleep, guys. Finally, if you are overweight or diabetic, managing these by managing your blood glucose and losing weight is important for heart health as well. I can really feel like a bit of a broken record recording these episodes. I feel like all I say is diet, exercise, sleep. But there is a reason for it. For virtually every condition that I've researched and looked at, these three factors play a significant role. So implementing small changes today and starting the habit of living healthier can not only improve heart health, but also total health and wellness. I've had this discussion of small changes on this episode regularly. I think heart attacks are a salient example of the consequences of not taking care of yourself, though, so I think having a discussion around that is important. The negative health habits that are so easy to develop nowadays, like eating fast food, not exercising, staying up all night on your phone and scrolling, not getting good sleep, they have consequences and they can lead to some serious conditions. Heart attacks are a salient reminder of why it's so important to take care of our health. Contrast heart attacks with something else we've talked about on the show, hypertension. With hypertension, you don't necessarily feel all of the symptoms and the consequences right away. However, heart attacks can be very serious, life-threatening, and all of the rest. The kinds of mindset changes that we talk about have the capacity to prevent them as well. I think using examples like heart attacks can provide the stick in the carrot and sticks that we all use to motivate ourselves to live a healthier life. And we can indeed live a healthier life. We can prevent heart attacks. And in my opinion, that's some serious power. Think about it. Inside of you lies the power to prevent something as serious, as consequential, and as dangerous as a heart attack. And I think that's pretty cool. I also think that general education about heart attacks is something that is very important and certainly not sufficiently done, at least in the United States. If I had a magic wand, I would require CPR classes for all Americans so that we could all know how to respond to a heart attack. But alas, I do not, hence why I'm here talking about it. Taking a CPR class can give you amazing skills to save lives, plus it's not very difficult to learn. Normally, it's like a day-long class, so I recommend a CPR class for pretty much everyone. Again, great skill to have. And knowing the responsibility you have to others is very important with heart attacks. If you're at a restaurant having a nice dinner and someone keels over next to you, it can be hard to act. The bystander effect can disperse responsibility to the point that nobody acts, wasting precious moments. Personally, I think in these kinds of situations, you have to take responsibility and that it's your duty, because even though you may not know this person, the action that you take that is rapid and saves a couple of seconds may mean the difference between life and death for them. Even if you just call 911 to make sure that medical help gets there promptly, you're engaging in part of a process that may just save somebody's life. Heart attacks are serious. We have looked at the anatomy of what actually happens during a heart attack and why they form. Understanding why they form can elucidate certain preventative measures like reducing cholesterol. However, once you have had a heart attack, there's an intricate system in place that can respond and treat it. This system works best when the heart attack is identified quickly and medications and procedures are given and performed quickly. This means that as a bystander, it can be a matter of life and death to get help and perform CPR. Furthermore, I think that heart attacks give a good example of how much power you have over your own health. Because in your own self-agency, you have the power to prevent heart attacks, one of the most common forms of death and scariest things to consider when you're considering your own health. Hopefully today's episode helped to shed some light on not only what a heart attack is, but also what we can do about it, and even what you can do about it if somebody around you is having one. Anyways, thank you all for watching. I hope you all have a good one, and make sure to share the podcast and follow. Peace.